Reporting tonight, David Muir.
Good evening on this Friday night. That battle over birth control reaching a flashpoint today. The president shifting course as the White House tries to calm the backlash from the Catholic Church and from some Americans who say he went too far. The president has said employers, including religious organizations, should provide women who work for them with insurance that covers birth control. Those workers, everyone from teachers to office workers to the nurses in their hospitals. Well, tonight the president is trying to take the church out of the mix. As we look at the numbers here, 84% of Americans polled, including Catholics, support birth control. But when asked if employers, including the church, should be forced to provide it, 49% saying yes, 46% saying no. A huge debate. And Jake Tapper was at the White House today as the president tried to calm this storm. Jake?
David, President Obama said that his administration really originally wanted to take about the next year and a half to hammer out some sort of accommodation for these religious groups. But after the uproar, he realized they did not have that much time. An uproar, he said, that was born from both genuine concern and cynical politics. After 2 weeks of political ulcers, the president took a step back today from his new rule and announced what the White House called an accommodation.
We've been mindful that there's another principle at stake here, and that's the principle of religious liberty. As a citizen and as a Christian, I cherish this right.
The White House seemed taken aback by the firestorm ignited by its new rule. Under it, health insurance policies provided by most employers had to fully cover birth control. That included religious charities and schools, despite their theological objections to it. Passions on both sides, as seen at the Catholic University in Washington, D.C.
I think that reproductive health care it's necessary. I mean, and it's a human right for women to be able to have that.
I don't know of another case in American law where a religious institution or a religious individual has been forced to pay for an activity that he or she views as sinful.
It seemed an unbridgeable chasm, one the president attempted to solve this way today. The new rule, health insurance policies of nonprofit religious organizations do not need to include birth control in their coverage. But the government is mandating that the insurance companies offer those services without charge to the women who want them.
Religious liberty will be protected, and a law that requires free preventive care will not discriminate against women.
Both the Catholic Health Association and abortion rights groups approved. And the group leading the charge against the rule, Catholic bishops, called the announcement a first step in the right direction. But some religious groups remained unhappy, calling the announcement an accounting gimmick.
Religious groups are still forced to buy insurance, and the insurance companies that they pay are forced to give contraception to their employees. So they're still forced to violate their religious beliefs.
Also left with some concerns, David, the group that has to pay the tab, the health insurance industry. They say that it's actually cheaper in the long run to pay for birth control because pregnancies are so expensive, but there are serious questions about where that initial short-term funding will come from. David?
All right, our chief White House correspondent Jake Tapper leading us off tonight. Jake, thanks so much.